For over 15 years, the laryngeal mask has provided a safe and reliable alternative to traditional face masks and endotracheal tubes. A laryngeal mask is an innovative airway management device that consists of three main elements: an airway tube with a standard 15mm connector, a mask with a soft inflatable cuff, and an inflation tube equipped with a pilot balloon and valve. The laryngeal mask is placed over the laryngeal inlet, thus ensuring the passage of air while effectively guarding against harmful gastric reflux. The inflatable cuff conforms to the shape of hypopharynx and thereby creates a seal. The tip comes to rest on the upper esophageal sphincter. This non-invasive position eliminates potential damage to the vocal cords, making it unnecessary to administer muscle relaxants specifically to enable insertion of the laryngeal mask. Each Ambu laryngeal mask comes in its own individual sterile peel pack. Several sizes are available for both children and adults. Choice of size is usually dictated by the patient's weight. Prior to use, make a visual inspection of the device for any damage. Inflate and deflate the device and make sure it is functioning properly. If necessary, press the mask against the flat surface when deflating to eliminate wrinkles and folds on the cuff. The mask should be lubricated on the distal posterior side of the cuff, using, for instance, a sterile water-based lubricant. When the patient is asleep, the head is tilted slightly back and the ambularyngeal mask is inserted into the mouth, held at the end of the airway tube. The anatomically correct bend in the tube ensures that the ambularyngeal mask glides easily into position without twisting and without having to put tools or fingers in the patient's mouth. There are many other insertion techniques in current use. Please insert the ambularyngeal mask according to the specific techniques recommended by your institution. The cuff is now gently inflated so that it forms a seal against the airway wall. The goal is to use as little pressure as possible to avoid trauma, for example, due to ischemia. By ventilating the patient manually while inflating the cuff, it is easy to hear when the airway is properly sealed. Because the ambularyngeal mask features an extra thin cuff, it easily conforms to the shape of the wall with exceptionally low intracuff pressure. The ultra-thin pilot balloon on the inflation line provides a precise tactile indication of the degree of inflation. Here, you can see exactly how the ambularyngeal mask is positioned in the patient's airway. The patient can now be attached to the ventilator. The clear inspection window in the airway tube allows you to visually monitor the ventilation and see condensation. To remove the ambularyngeal mask, simply detach the resuscitator, deflate the cuff, and withdraw the mask. It must now be disposed of. The anatomically correct bend in the tube ensures that the ambularyngeal mask glides easily into position without twisting and without having to put tools or fingers in the patient's mouth. Unlike other laryngeal masks, the Ambu cuff and airway tube are molded as a single unit. This provides uniform high quality and significantly reduces the risk of abrupt failure during use. The tube itself is flexible at the cuff and rigid at the connector for easy atraumatic insertion and removal. Special internal ribs built into the curve give the tube the flexibility needed to adapt to individual anatomical variances and a wide range of head positions. Ambu's state-of-the-art production methods eliminate fins and ridges on the side of the cuff, so that the mask does not scratch delicate tissue. The extra soft cuff is 0.4 mm thick, thinner than most other masks, so the best possible seal is obtained with the least possible internal pressure. The reinforced tip on the cuff is specially designed so that it will not fold and automatically comes to rest in the proper position. Most important of all, the Ambu laryngeal mask is a sterile, single-use device, which reduces the risk of cross-contamination and other hazards. And unlike traditional reusable devices, there are no extra costs for cleaning, inspecting, and maintaining usage logs. That means the Ambu laryngeal mask is as cost-effective as it is safe and convenient.